Have you received your email? All personal care agencies in the state of Maine have received an email from ODS on July 25, 2024. ODS stands for Office of Aging and Disability Services, ODS. It says, I am writing to inform you that a representative of the Department of Health and Human Services, Office of Aging and Disability Services, ODS, will be conducting a quality assurance review of personal care services providers for the fiscal year of 2024. The purpose of this review is to perform a follow-up policy monitoring from the previous review conducted in 2022 for Maine Care Section 19 home and community benefits for the elderly and adults with disability. The review includes all agencies that provide personal care or personal support services through Section 19. This review will cover the following staff qualifications and requirements. Number 1, evidence that a criminal background check was completed through Maine Background Check Center on the PSS or the CNA. Number 2, evidence that a check on Maine Care Registry, CNA Registry, was done through Maine CNA Nursing Assistant Direct Care Workers as PSS. Evidence of a valid certificate of training for certified CNAs, if applicable. If you hired a CNA, you need to prove that they were CNA certified. Evidence of a valid certificate of training as a PSS, if they're applicable. If they're not, evidence to support that the PSS has completed training and exam within 9 months of hire, if they are not certified already when they hired. So you can hire PSS, but they must be certified within 9 months, or you cannot bill services and get paid for that services because they no longer qualify to do the job. Evidence that certified PSS has completed an agency orientation, or evidence that newly hired PSS who are not yet certified completed an 8-hour agency orientation. Documented evidence that an initial supervisory visit occurred with the member before the start of a PSS services. Documented evidence that a PSS on-site supervision in the member's residence was completed every 6 months. So a supervisory done every 6 months. A copy of your agency's current policy and procedure manual. That's what they will be looking for. Now, if you are using Software, all of these should be already there for you. All you have to do is go and print out. The first step to this is that you present employee roster. If you are on Software, go to Software report, or employee, and print the report that includes the employee with the job title. Okay, that is what they're looking for. All you have to do is print that report and send it to them, and then they will come back and ask you what record they want from you that includes all of these things. Now, about a month ago, we have added a supervisory requirement on the plan of care. That means as soon as you try to do a plan of care in Software, it will force you to also schedule a supervisory visit before you can save. That is because of this regulation. You need to make sure you are scheduling a supervisory visit at least every 60 days, every 60 months. You need to make sure you are scheduling a supervisory visit at least every 6 months. And the first 3 months, schedule once a month virtually if you want to. Or if you want to go do on-site supervisory, then you can schedule multiple supervisory visits. The way I will go about this, I'm doing an admission. Okay, I have the form signed. Now my admission supervisor is going to be presented with a plan of care. And in that plan of care, it will be right after you put the shift schedule, they'll be presented with an option to a requirement to add a supervisory visit. You can add as many as supervisory visit, but what I would say is add 4 supervisory visits, 1 for every month. Supervisory visit 1 will go from today to 30 days from now, assigned to the office manager or the supervisor. Supervisory 2 from now, from 60 days, from 30 days to 60 days, and then from 60 days to 90 days. And then schedule once every 6 months from there on until the plan of care expires. You need to do that. It's required. Supervisor visit required, and software is now requiring you to add a supervisor visit before you can save the plan of care, which means it will automatically schedule for you, right? So that you don't have to try to remember, oh shit, which my patient did not get a supervisor visit. It will be on your schedule. Just look at it. Okay. Well, that's what it is. We have a statewide audit, and we need to be compliant. And if you have been using software properly, this should be a very easy, straightforward print and send.